Okay. Here we have a lady 28-year-old who has regular menstrual cycles. केव्हा आली होती पाळी तुमची? अच्छा. So it was on the 5th of this month. So today is 28. So it is her 16th day of her period. It is very important to correlate the menstrual day of each lady when you are doing a transvaginal sonography. Transvaginal sonography shows us the endometrium very nicely. So here we have gone in and now we can see that the fundus is on the right side of the screen and the cervix on the left side. Bladder is anterior, empty, and so this again is the anterior myometrium, this is the posterior myometrium, this is the fundus, cervix, this is pouch of Douglas where we can see little fluid, and uterus is moving very nicely. There is no pain anywhere. So we say the sliding sign is positive because there is no pain. All structures are easily and very nicely moving. So again we took this in the long axis and the focus point we will shift a little, will increase our image size so that more than most part of the screen is covered by the image we are interested in. And now we can take the endometrial measurement. Yes. At the fundus, no, little we have to go exactly vertical. This is it. So it is around 8 mm. So 15th day 8 mm, yes, it is corresponding. So it's good. Here myometrium otherwise normal, there is no fibroid, and now we have turned our probe at right angles to our sagittal section. Now we got the coronal section. We will take measurement of the uterus in this. I think we did not take the long axis measurement. So this is little bulky uterus. 5.5 for coronal section is little on the higher side. We can take किती मुलं आहेत तुम्हाला? हाँ, तो even she is multiparous, 2 children. So it's not a proper section. It's not seen nicely. Now we can take. Should we decrease a little? Depth. No, how do we go down? What happened? Yes. We can take the measurement. We go. Yeah, there are various methods of taking measurement of the uterine length. One is direct point-to-point measurement. Another can be this trace measurement. Nowadays, with volume probe, we are trying to take volume measurements also of endometrium. So obviously now we should also comment on the echogenicity of the endometrium. Here it is appearing almost, it's going into the secretory phase. Let's see the status of the ovary now. We are now in the right fornix. We are doing to and fro movements, side to side movements to get the ovary. Yeah, we got this. We can see the internal iliac also. We are getting to see the ovary in the ovarian fossa. So we should again take a dual measurement so that you can take in both the axes, the other side. When we are doing ovulation study, we should keep endometrium and follicular size in the same screen. Yeah, so they should be ideally got into the center before you do the measurement, but it's okay. So this is, we have already mentioned. So you can do it again. Okay. And similarly, we go into the left fornix now, and the left ovary is. See, now we are trying very hard to. We are getting to see the ovary, but still it is little difficult. Yeah, we got to see. Now we should 1 minute. We should decrease the angle so that it is more clear. The span should be decreased. Not there? Doesn't matter. So yeah, it's so the area of interest is well focused. See, the image quality improves immediately. Okay, can you increase the depth so that the image comes? Yes. So when you have images like this, you are very confident what you are seeing. Now, can we put color in this? Increase the angle a little, yeah. So now we are trying to see that. And what is the frequency that you have kept? Can you freeze it? Yeah. So I think the frequency of the color should be very okay, around 5. Yeah. So now we will take measurement of this follicle. This follicle appears irregular. We are seeing internal echoes. So maybe today is her ovulation day. Maybe. Because she came with complaints of pain in abdomen since yesterday. So her clinical complaints are fitting with the findings. She had pain in lower abdomen on the left side. And today is her 15th day of menstrual cycle. Endometrium is also showing that 3-line sign going into secretory phase and and follicle rupture and fluid in POD. Okay. So this was her endometrium. Fine. We have one more case of post-menopause. We will try to see endometrium in post-menopausal lady as well. Okay, thank you.